Alright, hi guys. So let's get started with the next episode of 5 MCQs in 5 minutes. Through these MCQs, we are actually revising 5 high yield topics as well, right? So right now I'm discussing January 2023, and this series is going to be beneficial for FMGE, NEET PG, and INI-CET, all the aspirants. Let's see the first question that we have. A child consumed multiple iron tablet and brought to emergency room. Okay, so iron tablet and again emergency room. Again, the main symptom will be GI symptom, nausea, vomiting, abdominal pain. Which of the following is the antidote of choice? So for iron poisoning, the antidote of choice, everyone is aware of deferoxamine. Now they changed this one in the NEET PG. What they said that the patient is coming with a multiple episode of blood transfusion, है ना, with history of, there is a patient with a history of thalassemia. Which of the following will be utilized to chelate the iron? So in this case scenario, with the history of thalassemia, remember all the thalassemia patient definitely will be needing the multiple blood transfusion. So for them we will be using oral iron chelator. Oral chelator that we have is deferipron and deferasirox. Deferipron and deferasirox. This is the oral iron chelator. D-penicillamine is mainly for the copper. ETA ball can be utilized for the lead. Do remember this one. Iron chelator is emergency condition due to deferoxamine, right? So the entire list I have given you already, the entire list of the table where you can easily remember all the important antidotes. Like for example, organophosphate carbamate ke liye we are having atropine. Like for example, opioid ke liye we are having naloxone. Okay. Like for example, paracetamol ke liye we are having N-acetylcysteine. Acidic drug poisoning, I have told you, forced alkaline diuresis, and basic drug poisoning, forced gastric diuresis. We have discussed this already. Let's see the next one. Which of the following drug activate PPAR alpha? PPAR alpha, peroxisome proliferator activator receptor alpha. Alpha, I always say alpha, fa में एक F word आ रहा है, alpha phi, है ना? F word सिर्फ एक चीज के लिए नहीं होता है, बहुत सारी चीजों के लिए होता है. Pharma में fa phi, right? Alpha is phi is fibrate. PPR alpha, phi. Now, why am I so much stressing about alpha? Because there is something also called PPAR gamma. Gamma, G for glucose. So drugs like your pioglitazone, rosiglitazone, troglitazone, they are the PPR gamma agonists. They are the insulin sensitizer. They are going to increase the insulin sensitivity. What about this one? What about fibrate? Fibrate are mainly going to act by nuclear receptor, and by acting by nuclear receptor, they are going to increase the level of lipoprotein lipase enzyme, and this lipoprotein lipase will be causing triglyceride ka breakdown. Triglyceride ko break karega. Correct answer for this one, all the fibrate. Gemfibrozil, we are having others like clofibrate, phenofibrate, है ना, they are all fibrate. इनके नाम में फाइब्रेट या फाइब्रो वर्ड आता है ना, फाइब्रेट, क्लोफाइब्रेट, फिनोफाइब्रेट. Okay. Ezetimibe, it's easy peasy drug. Ezetimibe is easy peasy drug. It is simply going to inhibit the cholesterol absorption, right, by inhibiting the Niemann-Pick like one transporter, NPCL1 transporter in the intestine. Statins, right? They are the statin, that is HMG CoA reductase inhibitor. HMG CoA reductase inhibitor, simvastatin, pravastatin, any of the statin. They are ending with a vastatin. Remember that. Okay. Correct answer for this one is gemfibrozil. Next is the next one. Which of the following can be used in the management of the chemo-induced nausea and vomiting? For the chemo-induced nausea and vomiting, ondansetron happens to be the drug of choice. They are the drug of choice. But for the delayed nausea and vomiting, we are having, they are the drug of choice in delayed nausea and vomiting. That means even after chemotherapeutic infusion, if the patient is coming 24 to 48 hours after that and he's having nausea and vomiting non-responsive to ondansetron, we can utilize this. And steroids have also shown to be effective in this chemo-induced nausea and vomiting. Among the other choices, remember, they are simply, some of them are antihistaminic like chlorpheniramine, some of them are D2 blocker that are not very effective in chemo-induced nausea and vomiting. Same like metoclopramide, they are mainly associated with the extrapyramidal symptom, dystonia जिसको बोलते हैं ना. Among the given choices, the only one that is having correct group of drugs that can be utilized in chemo-induced nausea and vomiting is ondansetron, dexamethasone, aprepitant, option A. Let's see the next one. Which of the following agent will be used for the treatment of diarrhea? I just discussed in the previous episode of this one. Diarrhea in a patient that is, again, for colorectal carcinoma with 5-fluorouracil and irinotecan. That means chemo-induced diarrhea. And the drug of choice we have discussed, right? Loperamide. So this same topic has already been asked in June 2022. January 2023, they have changed it a little bit of language and they have asked, right? Same kind of drug that can also be utilized for the drug of choice of preferred drug also, in a patient with the traveler's diarrhea. They are the opioid, traveler's diarrhea. The drug of choice for nausea and vomiting, I have already told you that is going to be your ondansetron, chemo-induced nausea and vomiting. Ciprofloxacin is fluoroquinolone. Ornidazole, again, coming from the same family of metronidazole, ornidazole. They are for the gram negative. Atropine is an antidote for organophosphate and carpamate poisoning. Last question for the day: which of the following use local anesthetic used for IVRA, IV regional anesthesia? So let's say you are going to have a surgery on your upper limb or lower limb. In that case scenario, you have to give a BP cuff. BP cuff will be inflated, and after inflated the BP cuff, you are going to use IV lidocaine you will be giving, so that there will be less faster distribution of this drug, and you can do the surgery, right? The drug will be accumulated in this area. For example, you want to have a surgery in this area, then you need to apply a cuff here, and that will be inflated, and you can give IV regional anesthesia. उसके लिए हम use करते हैं lidocaine very commonly, not Devoting, not bupivacaine, not ropivacaine, right? Remember, the most cardiotoxic is going to be bupivacaine. I used to say beauty is very, very toxic, beauty is very much toxic, cardiotoxic. All right, so among the given choices, A is the correct answer, right? So with this one, we are done with our 5 MCQs in 5 minutes. ये घंटी बजते ही मैं भी डर जाता हूँ, है ना? Thank you very much to all of you guys. Please don't forget to like, share, and subscribe to my channel, and I'll see you in the next episode.